Hello, I'm Deborah Quilter and welcome to RSI Help YouTube. So coming back to the show is Jim Harwood. He's the co-owner of New York Physical Therapy and a physical therapist specializing in osteopathic manual practice. He's going to tell us a little bit about osteopathy and how this practice can help you with many things, including RSI. So welcome back to the show, Jim.
Thanks, Deborah. I appreciate it. I think one of the best ways just to understand it, osteopathy, and well, I guess I should clarify too, Deborah. I am not an osteopath. I am a physical therapist who has learned the manual art of osteopathy. In America, a DO is equivalent licensure to an MD. You know, they can prescribe drugs, they can prescribe MRIs, X-rays. They're cardiologists. There are many things. If you ask me, they've kind of, well, I don't want to get too tough, but they've kind of betrayed the actual origination of the idea of an osteopath, which was a man by the name of Andrew Still back in around the Civil War time, a medical doctor at the time. And he had a very spiritual man. He was a genius too, but he had several children who died of, I guess, maybe the flu or some things that he thought should have been preventable. And he ended up basically giving up his medical practice, and he decided that he just couldn't fathom the fact that he couldn't save his kids and his patients at the time. But he left his medical practice. He studied anatomy, physiology, and not to sound hokey or kooky, but he ended up saying that the idea of osteopathy was revealed to him by God. He was a very religious man. So he doesn't take credit in inventing osteopathy. He just thinks, because at the end of the day, all osteopathy is predicated on is the belief that each and every one of us has an ability to heal ourselves. So with that in mind, an osteopath is the person who would, you know, if you came in with a cold, we're not given a prescription for an antibiotic or any of these things. They're going to understand the relationship, say, between your thoracic spine and your lungs and your sinuses and all these really important connections and your autonomic nervous system. And they would look for different areas that are blocked there and free that up so that you would cure your own cold. So in essence, that's basically what the idea of osteopathy is. It's to try to look at any individual any given time and figure out, you know, certainly you want to hear their story and understand what they're going through. But the real goal is not necessarily to relieve pain or treat pain, but really is to try to find the areas that are blocked to allow the individual to heal themselves, right? Yes, go ahead. Sorry.
My understanding of it, in addition to that, because I read Dr. Still's book.
Oh, you did?
Yes, many years ago. And as I understand it, osteopathy works with aligning the bones, putting the bones in proper alignment, and that would in turn allow the organs to function the way they should, so that the body would heal itself because everything was in its proper place. Am I understanding that?
I would say that is a piece of it. I think that when in Still's time, you're right. He was a very big bone mover and all these things. But again, that was 1870 or so. And since then, it has evolved. The whole cranial sacral treatment was not part of the Still model. One of his students, William Sutherland, is the guy who came up with the idea of treating the cranium, which is a very important osteopathic tool. We won't get into that right now. It can go many places. But it isn't just that, though. It is also, you know, somebody's liver could be not moving right. And you made the technique for that day may be, we got to kind of get the liver moving. You know, if you think about what the liver is, it's a very big organ in your abdomen. And you can imagine if that is not moving properly, the impacts it can have all over the place. Scars. I mean, we talk about scars all the time. Any scar, like we call it like a black hole. Everything gets pulled to it, and so anytime you find a scar in somebody, it's really important to try to work and make sure that that's freed up because it'll have an impact throughout. But you're right. If I'm on somebody and their right SI joint is dysfunctional and it needs to be moved, we're going to move it. But I think the biggest difference, and there are different ways people express or work their osteopathic treatments. I'm a big believer in that, you know, the key is dialoguing with the person's tissues, whatever it is, finding out where it's blocked, and then trying to figure out the best way as I would say, as my Godfather friends would say, give the body an offer it can't refuse. Because the body is always trying to do the best for everybody at any given time. I truly believe that. All I'm trying to do, or any person, and I believe Deborah probably in your practice too, all we're trying to do is kind of nudge the body and give it support so that it can do what it knows to do better than any of us, right? So that's basically osteopathy in a nutshell. It's kind of, and then we have a methodology, right? So I know I'll go around the body looking for areas of the block and treat it. I will usually spend a few minutes on the person's place of pain, just so they're still hanging in there with me, so to speak, because their mindset is an important part to healing. But the truth be told, I often say, pain is often the final expression of a very complicated pattern. My goal is to respect the pain, do my best to relieve it, but my goal really is to turn around that pattern. And if you do that and you help somebody do that, in my experience, the pain goes away. So it's not just about treating pain. It's about really trying to find out where the issue is based on our methodology, where a chiropractor may be always looking at the alignment of the vertebra, as they see as a very important component to a person's ability to heal themselves. An osteopath his focus is a little different than that. I mean, one of the main focuses is the cranial sacral rhythm in the dura, again, which gets into a whole nother idea, but just, I guess it's safe to say that the osteopathic practitioner, manual therapist is always looking at the body as a whole and understanding the relationships everywhere, and then with that, trying to find out where it's blocked so that, again, the body can heal itself. That's basically osteopathy in a nutshell.
Thank you for that wonderful explanation. And I hope that people will try osteopathy and find someone that they resonate with who has that kind of holistic approach. And the other good news, if you don't already know it, is that osteopathy is covered by insurance. So this is a big deal for people with RSI who have insurance. And I've had wonderful experiences with it myself, and I do recommend it for people. So I want to thank you for coming to us. Do you want to give us your website so that we have it?
Sure. Site, which is www.nypthealing, that's HEALING.com, nypthealing.com.
All right. Thank you so much for coming on the show, and thanks everybody for listening, and come back soon.